Cranial nerve 1, also known as the olfactory nerve, controls the sense of smell. This nerve isn't frequently tested even by neurologists. However, suspect an abnormality in a neurologic patient who has a poor appetite. To assess the nerve, use soap or coffee. Both are easy to find. Have the patient plug one nostril at a time.
Do you smell anything?
I don't smell anything.
All right, let's plug the other nostril and see.
I smell coffee.
All right, awesome.
Because the patient did not smell anything from the right nostril, an ipsilateral right lesion is indicated. Also, because she does not smell something, this is known as anosmia. Located in and behind the eyes, cranial nerve 2, the optic nerve, controls the central and peripheral vision. To test the optic nerve, you will have the patient do multiple items. First, have the patient cover each eye one at a time and ask them to read a sentence to you from approximately 6 inches away.
All right, can you cover your right eye for me and read this top sentence?
We love neuroanatomy.
Awesome. Now can you cover your left eye and read the bottom sentence?
We appreciate Dr. Groh, Dr. Christensen, and Dr. Powell.
Awesome.
6 inches away. Hold up a certain number of fingers and ask the patient to tell you how many fingers you are holding up in front of him or her.
All right, next, can you tell me how many fingers I'm holding up?
3.
Awesome.
Test the patient's peripheral vision one eye at a time. You will ask the patient to cover each eye. It is important to test both the superior and inferior fields one at a time.
All right, so can you cover your left eye for me? And then tell me when you can see my finger coming in.
Stop.
Awesome, now we're gonna do it again down here.
Stop.
All right, let's do it for the other eye.
Stop.
And again down here.
Stop.
Awesome.
There were no indications of difficulty or problems with this patient's optic nerve. The patient has a problem with this nerve. It typically involves the forehead, cheek, and jaw, the 3 areas of the trigeminal nerve. Be sure to check sensation in all 3 areas using both a soft and a dull object. Don't forget to check sensation in the scalp. Have the patient close their eyes so they cannot predict which area you're going to touch and whether you're touching it with a soft or a sharp object.
All right, I'm gonna have you close your eyes and will you tell me when you feel an object touching your face?
Yes.
All right. And which side it's on?
My left cheek. My chin. My forehead. My right cheek.
And can you tell me if that was a hard or a soft object?
Hard.
All right, now we're gonna try it again. Close your eyes again.
Chin. Right cheek. Forehead. Left cheek.
Awesome.
It's also important to check the function of the temporal and masseter muscles by assessing the jaw opening strength, as these muscles are affected by the trigeminal nerve. Have the patient jut out their lower jaw and hold it there as you apply simple pressure against it. It doesn't have to be hard. As long as the patient is able to maintain their jaw, there is no problem. As you can see, this patient has not had displayed any problems with their trigeminal nerve. Cranial nerve 7, the facial nerve, controls facial movements and expression. Assess the patient for facial symmetry. Have him or her wrinkle their forehead, close their eyes, smile, pucker their lips, show their teeth, puff out their cheeks. Both sides of the face should move the same way, without facial drooping on one side or one side remaining the same while the other side moves. When the patient smiles, observe the nasolabial folds for weakness or flattening. As this patient has displayed, there are no problems with her facial nerve. Nerve 8, the vestibulocochlear nerve, located within the ears, controls hearing and the vestibular sensation, also known as your balance. Check this by rubbing your fingers together next to the patient's ear.
All right, I'm gonna have you close your eyes and tell me which ear or which side you hear this on.
Left. Right.
Perfect.
There were no problems indicated with this patient's vestibulocochlear nerve. Cranial nerve 9, glossopharyngeal nerve, and cranial nerve 10, the vagus nerve, which innervate the tongue and throat, the pharynx and larynx, are checked together. Observe the patient's ability to swallow by noting how he or she handles secretions. Ask the patient to open their mouth and say, ah.
All right, can you open your mouth and say ah, ah, ah?
Ah, ah, ah.
Perfect.
The uvula should be in the midline, and the palate should rise when the patient does this. You can see the secretions at the back of the patient's mouth. Also, when you put an object into the patient's mouth, this will initiate the gag reflex.
All right, next we're gonna test your gag reflex. Can you open your mouth? Perfect.
As noted with this patient, there appear to be no issues with her cranial nerve 9 or 10. Cranial nerve 12, the hypoglossal nerve, innervates the tongue. The patient should be able to stick it out into the midline.
All right, can you stick your tongue out straight for me? Perfect.
This nerve also will, if there are issues with this nerve, the patient will have difficulties with speaking. This physician has noted throughout the assessment that the patient has not had any indications of difficulty with speaking.
All right, after assessing all of the cranial nerves, I have concluded that you have a lesion to the right olfactory nerve, which affects your sense of smell.